During National Drug Authority enforcement operation in Westnile region, over 50 outlets have been closed in which over 150 boxes of assorted drugs were impounded by the team of operation, which is worth 40 million. The operation is basically on assorted drugs, outlets operating without license, drugs imported from neighboring countries such as DRC and South Sudan, outlets operating in minimum standard premises. The 5 days operation covered districts of Koboko, Maracha, Obongi, Yumbe and last Larue district in which illegal cases were rampant in Koboko and Obongi. Dr. Umurambe Emmanuel, Regional Inspector of Drugs for Western Region, highlighted the public on the dangers of illegal operating in selling of drugs.
If you have a drug shops which you have not licensed, which means we cannot go to you to provide even support supervision. During support supervision, we discuss many things which you should do right, and we identify the wrong things you are doing. Now, if somebody is not licensed, it means this person is doing wrong things. He is even selling expired drugs, he is giving wrong dosage, he is not giving correct information to patients, so it is a risk. He is even selling smuggled drugs. We cannot go there to identify this because this person has not been licensed. We go there only to enforce. So those are the dangers of not licensing.
Dr. Makumbi Tom, Senior Inspector of Drugs, National Drug Authority, said there is a reduction in the number of illegal activities in this financial year compared to last financial year, and further highlighted the public with the level of punishment depending on the crimes.
We have about 59 outlets. It means that from the previous financial year we are seeing a reduction of more than, I think, 50%, almost 50% reduction in the number of illegal outlets. In case you are a qualified person, but you are found operating without a license and you are prosecuted in the courts of law, you will pay 1 million Uganda shillings as a fine, or serve 5 years in prison, or both. Again, you can do both. I've talked about the government of Uganda drugs here. These items you see here have been retrieved from the private sector. They belong in the public sector. The taxes you pay have already paid for these drugs, and they're supposed to be given to the public free of cost. If you are convicted of a crime of unlawful possession of government stores, you will serve 7 years in prison. If the magistrate is in a bad mood, you will serve all the 7 years if you are found with these items. So those are the different avenues. But as I said, these are compliance operations. Ours is not to punish the operator, but to ensure the operator comes on board.
Joyce Obite, a concerned consumer in Marsa district, said operating illegally can at times make these health personnel to sell expired drugs, which at the end affects the health of the consumers, and urges the health personnel dealing in the sale of drugs to acquire license.
I'm called Joyce Obite. My village is of Ujo. What you are carrying is good because you also want to save people's lives. Me, I feel that selling outdated or expired drugs is not good because one may even get infected when one takes such amount of drugs. And they should also know their certificate, that the certificates of qualification must also be there.
Muzamil Kemis, an illegal operator, thanked the National Drug Authority for the enforcement operation and advises his colleagues to acquire license because it's not fair when you are not known by the overall body.
I want to thank the government of Uganda and then the Department of National Drug Authority for ensuring the service offered to the community should be commensurate with the law. I want to advise my colleagues, they should not run away, they should not fear to go to NDA because their services are as considered by the legislators and they are within pocket friendly. It is not proper to deal with the drugs when you are not known by the overall national supervisor in charge of drugs.
National Drug Authority is government-owned organization in Uganda mandated to regulate drugs in the country, including their manufacture, importation, distribution, and licensing, and all these are done to save people's lives. Oraku Benson Pastore, Westnile Television Nilecast.